Welcome, everyone. Saludos. And thank you for joining us for today's Wellness Wednesdays, our third community engagement and research webinar being hosted by the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago. Developed resources reported in this webinar are supported by the network of the National Library of Medicine, the National Institutes of Health, under cooperative agreement. The content is the sole responsibility of the authors and does not necessarily represent the official views of the NIH. The sessions throughout this series will provide health education information and resources. Today's webinar discusses the network of the National Library of Medicine's community health resources to support health literacy and LGBTQIA health and well-being. We will hear the COO of the Puerto Rican Cultural Center, Juan Manuel Calderon, share resources and programming supporting the LGBTQIA+ community. We're also joined by our program sponsors, Darlene Caskey from the University of Iowa and her colleague Jacqueline Leskovic, who will both share useful resources offered through the network of the National Library of Medicine to promote health literacy, research engagement, and wellness among sexual and gender minorities. Bienvenidos, mi gente. My name is Lisa Aponte Soto. I'm the founding president and CEO of Tanoma Consulting, the moderator of this webinar series. I'm a health and equities researcher and evaluator trained in public health, community participatory, culturally, and linguistically appropriate practices. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research evaluation and training services to advance health, education, and workforce equity. And for more information, you can visit us at www.tanomaconsulting.com. I want to quickly introduce our team. Ms. Xiomara Rodriguez, Director of Digital Presence Initiative at the Puerto Rican Cultural Center, or PRCC. Ms. Melissa Banerjee, Director of Development at the PRCC. Ms. Zenaida Lopez, Associate Director of El Rescate Transitional Living Program at PRCC. Ms. Emily Medina Rodriguez, Research Associate with the PRCC and Tanoma Consulting. And Ms. Kimberly Silva, Research Associate with Tanoma Consulting. Also want to introduce our liaisons. Esteemed researcher, Dr. Aida Diachello, professor at Northwestern University's Feinberg School of Preventative Medicine. Ms. Susana Gonzalez, nurse consultant educator with ASI Home Care, also member of the National Association of Hispanic Nurses Illinois chapter. And Ms. Monica Rodriguez, Director of Communications and Engagement with the All of Us program at Northwestern University. We also would like to acknowledge our partners for this webinar series, the Illinois Precision Medicine Consortium for the All of Us project, comprised of 6 Chicago-based medical centers, the Puerto Rican Agenda of Chicago, a nonprofit organization comprised of local Puerto Rican leaders ensuring the self-determination of Puerto Ricans in Chicago, throughout the diaspora, and in Puerto Rico through policy and advocacy. El Rescate and Vida Sida, 2 programs of the Puerto Rican Cultural Center that you'll learn more about in just a few minutes. The Illinois chapter of the National Hispanic Nurses Association, a professional, voluntary, and nonprofit healthcare organization dedicated to enriching the lives of Hispanic nurse individuals through the promotion of academic attainment, mentorship, professional development, and actively reshaping healthcare in the Hispanic community. And Illinois Unidos, a consortium of Latino clinicians, elected officials, public health practitioners, educators, and community organizers addressing inequities due to the impact of COVID-19 in the Latino communities and beyond. Before we begin, we want to know where you're from. We want to get to know you a little bit. So please enter your name in the chat. Let us know what organization you represent. And please enter what zip code you're from. So today we're doing zip codes, not city. So just pop in your zip code in the chat along with your name and the organization you represent. You can also follow the conversation by using hashtags AllOfUsResearch, PRCC-Chicago, LGBTQIA+, health literacy, health resources, and equity, or tag us at JACPRCC, at AllOfUsResearch, at Tanoma LLC, at NNLM GMR, at NNLM AOU, at Juan M. Calde, and at Leskovic. And finally, this session is being recorded to make it available to you following the session. And now, without further ado, we are delighted to introduce to you the COO of the Puerto Rican Cultural Center, Mr. Juan Manuel Calderon. Juan is driven to confront injustices that people of color face daily, particularly the Latino LGBTQ community. He has leveraged community and government support to address great disparities in education and access to resources. Formerly, he assumed leadership of Vida Sida and HIV prevention care and housing programs, which are projects of the Puerto Rican Cultural Center. Vida Sida is located in the area that has witnessed the highest rates of HIV among Latinos. Currently, he oversees several programs that can be standalone agencies. These include education, housing, public health, early childhood education, employment, urban agriculture, violence prevention, and arts and culture initiatives. He is a recognized activist and a celebrated community leader who advises local, state, and federal legislators. He is passionately active in policy efforts in the Chicago City Council and Illinois General Assembly. His recent accomplishments include the establishment of transnational partnerships with Cuba's National Center of Sex Education in Trans-Cuba, as well as partnerships with LGBTQ organizations in Colombia. He serves on the Chicago Board of Health as a member/commissioner, the board of directors, and serves as the treasurer of the National Museum of Puerto Rican Arts and Culture, the Richard Yates Local School Council and Stowe Elementary School Council, the Illinois Commission on Elimination of Poverty, the board of directors for Advocate Bethany Community Health Fund, the Chicago Low Income Housing Trust Fund, the Illinois Human Services Commission, and the Illinois Advisory Council on Youth HIV/AIDS Prevention, as well as the Trans Chicago nonprofit initiatives. And his efforts have been recognized by La Voz del Paseo Boricua's Top 10 Under 30. And you can read more about his other amazing accomplishments. Mr. Calderon also holds a bachelor's degree from Northeastern Illinois University and is currently pursuing a degree in public health at the University of Illinois at Chicago. And so now, Juan, thank you so much for joining us today.
And thank you, Doctora Aponte. I wanted to welcome everyone on behalf of the Puerto Rican Cultural Center. The Puerto Rican Cultural Center is a community-based grassroots educational and health education. It's premised on 3 principles. It promotes 3 principles: self-actualization, self-determination, and self-reliance of a Puerto Rican Latino community through the study, recovery, and celebration of Puerto Rican culture, as well as identity. These efforts, as Dr. Aponte gracefully shared, we have various different programs throughout the years that speak to community engagement and research, and that addresses the inequities among the LGBTQ community. Currently, the Puerto Rican Cultural Center has Vida Sida, which is an HIV prevention clinic that provides direct linkage to care, and we currently have a research initiative for a gay men's project. For us, I think that as we are looking to promote community research, we have to take into account and look at what are the 2 issues that have not been addressed in public health, which is economic development and racism. So a lot of the things that we are beginning to discuss, I believe that public health is discussing it at this time, we're discussing systemic racism, not discussing structural racism and economic development. So that is one of the 2 things that we're engaging on in our Gay Men's Initiative, is how do we lift people out of poverty? El Rescate Transitional Living Program is celebrating its 10th anniversary this year. It opened up March 3rd of 10 years ago, and that is a space for LGBTQ youth that were kicked out of their homes, that are living couch surfing or living in, at this point, in the streets. And most, that was created 10 years ago as we were confronting, and there were multiple studies that were done on homelessness among LGBTQ and also among people of color. One of the other initiatives that we have that I think is important to share is the Lisa Isadora Cruz Trans Chicago Empowerment Center. And I think that that is important because part of our goal is how do we create our own clinic, and how do we support different research as we are funded by the Centers for Disease Control and Prevention in SAMHSA to be able to provide different social services and provide behavioral health, HIV prevention and care and linkage to care, but it's how do we provide wraparound services for that one individual. So that is currently what we're doing as part of the Lisa Isadora Cruz Trans Chicago Empowerment Center. Moreover, we have the Community Prevention Mobile Unit, and I'll try to be brief because these are all standalone nonprofits, and I can go on to talk about the different initiatives that are within these small, within these programs and initiatives of the Puerto Rican Cultural Center that ultimately promote and address the inequities of the LGBTQ community in Chicago, but it's beginning to spread, including in Puerto Rico, among the trans community in Puerto Rico and our relationships that we have with multiple LGBTQ organizations in our island. The fourth initiative is our Community Prevention Mobile Unit. There we offer everything from prevention, and we provide different supplies, safe packets for the constituents across the city of Chicago. The homeless population and people in general that are in need of basic things. Some of the things that we are providing are masks, along with through our initiative of Safe Passage and our Promotoras de Salud, and a couple of other outreach staff that are providing to at-risk populations and populations, subpopulations such as the homeless and LGBTQ youth that get condoms, and then they get safety packets, and then they get gift cards because we like to give them gift cards if they need a plate of food to eat. And then the last initiative, but not the least, is the Helen Rodriguez Trias initiative. Is the construction of, our goal is to construct, and we're currently working in the promotion of creating our own people's clinic. I think that all of these different components play a role, and we have to stop siloing public health, and we have to look at how do we provide comprehensive care that is incorporated within social and public health. With all of that said, PRCC is excited to be in this strong partnership with the National Library of Medicine and our great partners at Northwestern University. Our goal is ultimately how do we work with institutions to be able to leverage and maximize and be data-driven, to be able to expand and address the health inequities that are impacting Puerto Ricans and Latinos, as we're beginning to see migrations coming into the city of Chicago and across the Midwest of climate change refugees, which is what took place for a sizable group of Puerto Ricans that migrated during Hurricane Maria. So with that said, I am excited. The Puerto Rican Cultural Center welcomes everyone to be a part of this panel, and thank you very much for your solidarity. Thank you.
Thank you so much, Juan. Very grateful to have you join us again today. Next, we'd like to introduce you to Ms. Darlene Caskey, who is the funding agent and our funding agent, and serves as the Community Engagement Coordinator with the Greater Midwest region of the Network of the National Library of Medicine at the University of Iowa. Ms. Caskey is an expert librarian, and she supports access to biomedical information. Since 2018, she has been helping raise awareness of all of us, a National Institutes of Health research program to advance precision medicine. In partnership with libraries, community organizations, and anyone interested in improving health literacy, she offers opportunities for funding, programming, and learning. Ms. Caskey.
Thank you, Lisa. I really appreciate that. So it is an honor to partner with the Puerto Rican Cultural Center, in order to bring trusted, meaningful health information to you. If you're not familiar with the National Library of Medicine, I'll give you a brief overview. It is one of the 27 National Institutes of Health located on the NIH campus in Bethesda, Maryland, and it is the world's largest biomedical library, offering a vast print collection as well as electronic resources to researchers, health professionals, and the general public. The network of the National Library of Medicine consists of 8 regional academic health libraries and over 9,000 partners nationwide who support the National Library of Medicine's mission to access and share health information, both in English and Spanish, and to raise awareness of all of us. So what is All of Us? It's an NIH research program to accelerate health and medical breakthroughs. And by looking at factors like where you live, what you do, your genes, and your family health history, researchers can discover what makes you sick or keeps you healthy. And they can develop and deliver the right treatment for the right person at the right time. And this is what precision medicine is: individualized care, treatment, and medicine. But in order to do this, we need to have people involved. And that's why All of Us is asking 1 million or more participants living in the United States to partner. By volunteering to join the All of Us research program, together we can build one of the largest and most diverse health research databases. And why is diversity important? Well, it's because healthcare is often one size fits all, but it hasn't always represented you. So to reflect on the true diversity of the United States, All of Us welcomes all races and ethnicities, as well as sexual and gender identities. The program invites people with low income or limited education. All of Us believes that everyone deserves to be seen, heard, and understood, especially when it comes to medical research. Current enrollment data in the program shows that 1.3% of participants identify as transgender or gender non-binary, 6.9% identify as gay, lesbian, or bisexual, and 17.4% report to be Hispanic or Latinx. These are interesting numbers, but All of Us wants to encourage more participation from these groups. But it does acknowledge that many communities lack trust of public health research, and All of Us recognizes that trust must be earned and built over time with lots of hard work. And that's why the All of Us research program currently partners with a vast network of diverse community and provider organizations, both at the national and local levels. Centerlink, the Center on Halsted, and PrideNet at Stanford University School of Medicine have joined with All of Us to raise awareness and provide education to the LGBTQ+ community. And through their leadership and partnership with the program, they're helping to build trust.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
When I came out, I didn't feel comfortable, I didn't feel safe, and that was a very hard place to be.
Coming out as lesbian, gay, bisexual, even now transgender, it was hard to do that. And so because of that, whenever you went in to see a doctor, you were too afraid to really actually say who you are.
The biggest obstacle, to be honest with you, and simply is this trust, right? Trust from the community on not being misgendered, not being mistreated.
The health community, healthcare, they didn't get that. At that time, they felt like everything is one fit, that no matter what happens to one community is going to happen exactly the same thing to the other community. And that's not the case.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
Oftentimes what happens, particularly within communities that don't feel safe within a medical field, is they'll prolong and they'll wait and they'll say, it'll get better, and then by the time they go to the doctor, it's so late.
My family has had issues like high blood pressure, diabetes, so I'm very mindful of that and really trying to do everything I can to resist that.
One of the things for me that I have to be careful of is, my heart. My mom died at a very young age, at the age of 43, of a heart attack.
What I really appreciate about all of us is really taking this approach to make it inclusive of as many people as we can.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people and treating those disease processes.
That's the only way we'll be able to find out and understand whatever that we need to do to take care of ourselves.
That's a call to be honest and
The All of Us research program is an ambitious...
Kind of off slightly, I apologize. But NNLM, as an All of Us partner, is grateful to collaborate with the Puerto Rican Cultural Center, because together we can support the health information needs that are relevant to your community and that can help you make informed decisions about your health. And by the end of April, look to the Puerto Rican Cultural Center website for health information from the National Library of Medicine and other trusted resources. So we hope you can imagine a future where healthcare is tailored to you. And we invite you to learn more by visiting joinallofus.org/Illinois and watching this one last video.
Somos una nación, un pueblo. Cuando recibimos el llamado a dar, nos unimos y descubrimos que nuestra capacidad de ayudar a otros no tiene límites. Aquí no tenemos miedo. Lo que se encuentra dentro de todos nosotros es más que tan solo información, es vida. Es más que un estudio o una investigación médica, es visión, honor y compasión. Por las venas de los Estados Unidos corre diversidad. El siguiente gran descubrimiento se encontrará en todos y cada uno de nosotros. Lo que encontremos revelará misterios, curará a los enfermos y eliminará enfermedades. Estamos invitando a 1 millón de personas para que formen parte de este momento histórico. Le pedimos a los Estados Unidos que haga una vez más lo que siempre ha hecho: marcar el camino hacia el futuro. Somos una nación, un pueblo. Todos somos diferentes y son esas diferencias las que nos guiarán a las respuestas para futuras generaciones.
Oh, thank you. Now I want to turn our presentation over to my colleague, Jacqueline Leskovic. She's currently the network librarian for the network of the National Library of Medicine in the Greater Midwest region, located at the University of Iowa. I almost said Idaho. University of Iowa Hardin Library for the Health Sciences at Iowa City, Iowa. Now she's been with NNLM since 2005 and has worked in many professional library capacities. And she spent her professional career in healthcare and health information access. And she has almost 20 years of practice as a registered nurse and maintains her nursing license in Illinois. As our network librarian, Jacqueline manages our regional membership database. So if your organization is not an NNLM member, she can help you join. And she manages the GMR website, the Partner Outreach Library Program, the data reporting system, and she is the office lead for emergency preparedness. Jacqueline couldn't be a better speaker for today's presentation because she has co-authored the NNLM course called Beyond the Binary, Health Resources for Sexual and Gender Minorities. Thank you, Jacqueline, for joining us from Chicago. You're in the area out there, and I will stop sharing and let you have the floor.
Hello there. The purpose of this presentation is to provide culturally appropriate health information resources for sexual and gender minority populations and those who support them, educators, librarians, community-based organizational staff, and healthcare providers. As a member of the community, I've done my best to use culturally sensitive language and examples. If I use terms that are unfamiliar or if I use a term or language inappropriately, please feel free to let me know. Language like sexuality is fluid over time, and that learning is a lifelong process. The LGBT plus community, as you know, can face additional barriers to accessing healthcare because of their sexual orientation. The fear of stigma can prevent LGBTQ plus people identifying people from scheduling regular health examinations and screenings. This puts them at a higher risk of not being diagnosed with or treated for serious health conditions, including cancer, mental health problems, HIV, AIDS, and other diseases. Fortunately, many local LGBTQ plus health clinics are trained in appropriate terminology and understand the specific health needs of LGBTQ plus identifying individuals. A few of the images I've selected in my presentation come from genderphotos.vice.com, and I find that those really have added so much to my my bag of images that are culturally appropriate. I'm not going to go into terminology here because I'm sure that most of you are familiar with the terms, what the LGBTQ plus stands for. If in case you need a refresher, GLAAD's Media Reference Guide is a good source, and also the National LGBT Health Education Center has a glossary of LGBT terms for healthcare teens. The National Library of Medicine is on the campus of the National Institutes of Health in Bethesda, and it's been a center of information innovation since its founding in 1836. It is the world's largest biomedical library and maintains and makes available a vast print collection and produces electronic information resources on a wide range of topics that are searched billions times each year by millions of people around the globe. It conducts research and supports it, development and training in biomedical informatics and health information technology. In addition, the library coordinates our 9,000 plus members of the network of the National Library of Medicine, and we promote and provide access to health information, as Darlene said. Since PRCC is a network member, that's how come I'm here today. And if your organization is not a member, as Darlene mentioned, please reach out to me, and remember that membership is free. Let's start off with Medline Plus. Medline Plus is one of the best resources for consumers as well as for professionals to access health information online. I have a brief video here, and hopefully we're going to be able to hear the volume on it as I launch the video. So let me know if we're getting there. There are several ways to search for health information for sexual and gender minorities in Medline Plus. An easy way is to enter a term such as gay in the Search Medline Plus box. The gay, lesbian, bisexual, and transgender health topic page is automatically suggested. Another way is to follow health topics to demographic groups and select population groups. Scroll to the topic of interest and select. Several population group headings cover gay, lesbian, bisexual, and transgender health in Medline Plus. So that's just a brief introduction to Medline Plus and how to search with a general term. One of the nice things about Medline Plus is that the pages all look alike, and there are resources there that you can look at from a variety of different for a variety of different topics. You always see the same kind of page. The image is always representative of the topic at hand. I want you to take a look over here. There's a link for translating the pages into Espanol. And one of the things I have to say that this is not a mirror site. This is the language and the foci here are directed towards Latinx cultures. Another option here to note is that there is a link to the journal articles that would come through PubMed. And you can see that they would be something very similar to this. This is not a comprehensive search, and it is not all inclusive. It's limited to articles from the past year. And when we look at PubMed, the search details of the journal articles will make a little more sense. For those of you who want more, there's information for trainers with a variety of resources for you to share with your constituents or to learn for your own needs. Okay, so PubMed.gov, PubMed comprises more than 32 million citations for biomedical literature from Medline, life science journals, and online books. Citations may include links to full text content from PubMed, PubMed Central, also known as PMC, which has full text availability, as well as from publisher websites. For information on how to search the PubMed database, you can see the PubMed user guide, or you can reach out to your partner outreach library here in Illinois for training on how to search PubMed. As we did in Medline Plus, we're going to do a first search on LGBTQ. We can see the search details by following the advanced link. And very simply, what PubMed has done is searched LGBTQ in all fields. Note how my search term is highlighted in yellow and my username is up on the upper right-hand corner. This is because I'm signed into my NCBI account where I have set my search preferences as well as my search filters. And you can see there under my NCBI search filters. This allows me to keep a bibliography, set search preferences, as well as notifications when additional literature is published that matches a search. If you'd like to learn more about my NCBI, the National Center for Biotechnology Information, let me know. Another simple search is using the term gay. When we look at, and let's go take a look what we have here. When we look here at the advanced search, we see that gay translates to what some described as a mesh term. Well, I'll get to that in a bit. In all fields. In this case, we could have results of an author named gay, or it could be something related to being married and gay. Note that there are 47,000 articles that would need to be looked through. And this is why there's another way to search a professional literature in PubMed with medical subject headings or MESH. Using MESH is a more precise way of searching, and we'll see in this slide the term sexual and gender minorities. I have another short video here on how to search MESH. In the previous section, we noted that sexual and gender minorities is a MESH term. MESH is updated annually to reflect changes in medicine and medical terminology, and the update is announced in the NLM Technical Bulletin. One way to access MESH is on the National Library of Medicine homepage under Products and Services. Select MESH from the drop-down box and enter your term to search MESH. Let's search gay, the G in LGBTQIA+ acronym. Gay maps to sexual and gender minorities in MESH. According to the scope note, this term applies to the following: individuals, including lesbian, gay, bisexual, transgender, queer, intersex, gender nonconforming people, and other populations whose sexual orientation or gender identity and reproductive development is considered outside cultural, societal, or physiological norms. The capitalization of gender identity in this description indicates that gender identity is also a mesh term. Note the See Also for gender identity, transgender persons. Transgender persons is a mesh descriptor for persons having a sense of persistent identification with an expression of gender-coded behaviors not typically associated with one's anatomical sex at birth, with or without a desire to undergo sex reassignment procedures. Scope note. Unlike PubMed, terms are listed only according to the applicable mesh descriptor, not as text words when searching mesh. Try, as I mentioned earlier, try as I might use outdated or incorrect terms during my presentation. NLM is also open to comments. A group of librarians, including myself, are instrumental in having NLM revise the term transgendered persons to transgender in 2016. NLM and all of us would appreciate your feedback as well. On the bottom of every page is a help button for writing to the help desk. During this current grant period with NNLM, NNLM also has a resource called the NNLM HIV/AIDS Coordination Center, or NACC. The goal of NACC is to enhance communication with current, past, and potential HIV/AIDS community information outreach projects, or ACIOP, awardees, and community-based organizations working on HIV initiatives to improve their access to trusted NIH and NLM HIV/AIDS information resources. You can access the NACC page under the tab Initiatives on the NNLM.gov homepage. HealthyPeople.gov is a service of the U.S. Department of Health and Human Services, Offices of Disease Prevention and Health Promotion. Healthy People provides science-based 10-year national objectives for improving the health of all Americans. For 3 decades, Healthy People has established benchmarks and monitored progress over time in order to encourage collaborations across communities and sectors, empower individuals towards making informed health decisions, measure the impact of prevention activities. HealthyPeople.gov is an interesting history related to the health of sexual and gender minorities. In 2001, a national collaborative of specialists in LGBT healthcare put together a companion document for Healthy People 2010. Although recognizing Healthy People 2010 as the prevention agenda for the nation, the authors of the companion document realized that little data existed on the overall health status of lesbians, gays, bisexual, and transgender persons. This companion document is still available online from the authors, the Gay and Lesbian Medical Association. It was not until Healthy People 2020 that LGBT health had a topic page of its own. And the goal was to improve the health, safety, and well-being of lesbian, gay, bisexual, and transgender LGBT individuals. You can still get that companion document from through interlibrary loan through WorldCat also, if you're interested, as well as obtaining the PDF version. And now we are in the Healthy People 2030 section, and with that we are hoping for more data-driven, as was mentioned earlier, information to help improve the health of LGBT plus communities. For Healthy People 2030, we have 4 very simple public health infrastructure needs. According to the Behavioral Risk Factor Surveillance System, or BRFSS, there are plans to connect the surveys that collect state data about U.S. residents regarding their health risk behaviors, chronic health problems, and use of preventive services. The simple baseline here is that 31 states, including DC and territories, included questions on sexual orientation and gender identity in the BRFSS in 2016, and now the target for 2030 is to increase that to 37 states. The CDC, another federal government resource, has its own resource page for LGBT health. And normally when we think of the CDC, we think about the U.S. responding to outbreaks and travel alerts, but it's also an excellent resource for SGM health information. There's a health services link through the CDC, and there's a really nice tool that can be added to your website about getting tested. And let's go take a look what that was. It would pop up on your screen, and you can search by location, your zip code, city, or state, and there are several in the Chicago and Illinois area. Of interest here is the hurricane preparedness information that is listed as an additional resource under the CDC. And there's also another link for emergency preparedness for as lesbian, gay, bisexual, and transgender LGBT people, what the health centers need to know. Having gone through 4 hurricanes in Florida, I can see why it's really important that we inform our LGBTQ brothers and sisters and friends to be aware of resources that will help them through an emergency. HHS.gov, or Health and Human Services, is a really simple way to go in and do a search. You just pop in your search term in the I'm looking for box and go and move forward. There are some other resources that I'm not going to touch upon here. Fenway Institute, for example, has great resources for training staff about LGBTQ health. And also I have created a link here. I'm going to pop this one in the chat. This is a resource that is available to all who have an internet access. And this is a link to the resource guide from the Beyond the Binary Resources. We touch upon general information resources, U.S. government, as we mentioned here, as well as training for healthcare professionals and students and other tools that can be used. There's a resource for services, societies, and associations, support groups, and specific resources for children and teens, seniors, healthcare, as well as for librarians. And want to acknowledge that today is March 31st is Transgender Day of Visibility. And as Darlene mentioned, there are resources that come from the All of Us LGBTQ resource page. So thank you.
Thank you so much, Juan, Darlene, and Jacqueline, for sharing these amazing resources. We will now open for questions.
This question is for Darlene and Jacqueline. Does the NNLM have like a fact sheet about the health and social well-being of the LGBTQIA community?
Thank you very much for that question. We are currently ending at the last month of our 5-year grant with NLM, and the website is changing continually. But I have some good news in that we do have a clinical conversations training program for LGBTQ plus affirming care, and I will pop that in here. The resources I would go to if one was asking about health information resources or any sort of concerns that LGBTQ people might have would be go directly to the Medline Plus page.
It just answered my question. Thank you. The other question is, sometimes, including myself, when I need something fast and dirty, for the lack of a better word, I go to Google search or Google Scholar, and I'm able to immediately in my finger, have several options of things that usually 99% of the time help me in whatever I'm looking for. I understand the benefit of going to the National Network or Library of Science because that's more science-based and it has accurate information than what Google could provide. But is there any other reason why we should try to go to the National Network or Library of Medicine rather than using some of the available popular site, for lack of a better word?
One of the nice things about going through NNLM, NLM, or NIH is that these resources have been vetted and they have been looked over by healthcare professionals as well as professional librarians. So you know that whatever you should come up with on either the NIH page or the NLM page, or anything that we link from NNLM has been vetted, and it's totally educational, and that there is no, it's not there for commercial purposes. We also have some training through medlineplus.gov, where one can go in and do an evaluation of resources that one might find on a quick search of the internet. And so skills such as learning to look for who's the author, the update of the page, whether or not there's money involved, or the communication about if you were to sign up for a certain page, what guarantees your privacy. So that is a whole training session for another day. These resources that I've provided today are available to anyone who has an internet access. So one can go in and view them, whether one belongs to a professional organization, a university, or a community organization, or just someone who is a member of the general public.
One question for Darlene. Now, Darlene, you shared some really useful resources in terms of the importance of the All of Us program and how it helps us individualize medicine so that we can have the right treatment for the right person or right patient at the right time. Can you share a little bit more about how someone can go about enrolling and what the process would be if, for example, I were to enroll today? What should I expect?
I would make sure that you read the page carefully. You go to the joinallofus.org/NLM, and there are specific instructions for informing you of your consent, making sure that you understand the process as you're going through it. And if you have questions at any time, there's always a chat feature and a phone number. There is always somebody that you can call to ask specific questions. So I would highly encourage you to do that. So especially if you go to the joinallofus.org/Illinois, you'll be reaching out to the Illinois Precision Medicine Consortium. That is a group of HPOs, health provider organizations in the Chicagoland area. And they are going to be very, very helpful with walking you through the process, making sure you understand what the program is and what you're signing up for. They want to make sure that everybody has full awareness, and this is a voluntary decision.
Fantastic, thank you. One thing that you noted as well, Darlene, and this could be for either you or Jacqueline, is that there are resources locally that have been provided from the network of the National Library of Medicine to the Chicago Public Library in the Humboldt Park area. Could you share a little bit more about how people in our audience who may be in the community could access those resources?
Yes. Prior to COVID, we were able to award 6 of the branch libraries in the Chicago Public Library system with a kiosk. It was an iPad set up into a small stand, and just by the nature of going to your library, you could access directly Medline Plus that Jacqueline shared, as well as some tutorials on how to get up to speed with digital literacy. Maybe you need to learn how to create a password, or you want to take that training that teaches you how to find quality health information. This would be directly available to you by going in to the Humboldt Park Branch Library and using this resource. So just follow the hours that they're open, and also follow all the COVID-19 procedures to stay safe, to keep your distance, wash your hands, wipe down surfaces, etc.
Wonderful. Thank you so much, Darlene. And lastly, Jacqueline, as Dr. Giacholo mentioned earlier, there's just so much information, right, that it can feel sort of overwhelming or intimidating. So many valuable, rich resources and opportunities for all of us to be able to dive in and explore. Do you have any recommendations or any actual tutorials that someone could access to provide them guidance, or maybe it's like a hotline number that someone can call in for additional assistance as they're trying to figure out how to navigate these portals?
Well, one of the things that we have is a partner outreach library program, and each state in our region has at least one library that can provide training resources. Currently here in Illinois, we have the University of Illinois at Chicago Library of the Health Sciences, all of the different branches, including the one in Peoria, as well as in Southern Illinois, at SIU, Southern Illinois University, we do have training. So in addition to reaching out to us directly at the network of the National Library of Medicine, one can reach out to the partner outreach libraries that are demonstrated on our website, and through them one can arrange for training. There are also a number of different videos, training videos that are a little different. Today I focus primarily on LGBTQ plus health, but the general resources, including that PDF I shared with the PubMed, should be of help.
Fantastic. Well, thank you very, very much, all of you, for your time. As we conclude, we wanted to share a few resources that you learned about during today's session. There's the link for the Vida Sida program. If you want to learn more, you can go to these links here, the PRCC-Chicago chgo.org/2016/11/16/16/Vida Sida, or for El Rescate, PRCC-DHGO.org/2016/20/11/L-Rescate-Basic-Center. Or for Trans Chicago, you can also go to the PRCC-Chicago.org, and you can search Trans Chicago and find that information. Or Illinois Unidos for resources on COVID-19. Since we are still in a pandemic, it's important to continue to stay up to date and informed. The resources available there are both in Spanish and English as well. Some upcoming events being hosted by the Puerto Rican Cultural Center on April 1st, tomorrow. You can look forward to at 4:30, as well as on Friday at 4:30. Professor and Chef Raúl Morris Garcia, who will be sharing some cooking tips on la alquimia del sofrito canábico. So creating sofrito with cannabis element or CBD oils, as well as La Bodega del Barrio Food Bank that presents various different nutritional classes every Thursday from 2 to 3 p.m. And El Jolgorio de Salsa y Más. That's every Saturday starting on April 3rd. So starting this Saturday, you can look forward to a summer event series with curated cultural performances at Huepa Mercado del Pueblo. Also, at Huepa Mercado del Pueblo, you can look forward to La Vuelta, some wonderful entertainment being featured on April 3rd. Some upcoming events that are part of our continuation of this Wednesday Wellness series. Next Wednesday, you can look forward to at 2 p.m. A talk from Dr. Angela Odoms-Young and Ms. Angela Ellison, as well as Mr. Juan Calderon from the Puerto Rican Cultural Center, as we will discuss redressing history and inclusive representation of African Americans in research. The following week, on April 14th from 1 to 2 p.m., we are joined by Ms. Leonie Calderon of the Puerto Rican Cultural Center and Dr. Ruth Zambrana from the University of Maryland College Park Campus School of Public Health, as they will discuss honoring Helen Rodriguez Trias and the contributions of Latinas in research. April 21st and 22nd, we have a 2-day summit hosted by the Puerto Rican Agenda and various other cultural groups, including and community partners, including the Puerto Rican Cultural Center. And lastly, on April 28th, we will have a discussion on recruiting and retaining Latinx older adults in research, featuring Dr. Marta Cerda and Dr. David Marquez. We will also have a conversation on April 9th, not featured here, discussing colorism and the impact of colorism with regards to research and equity. Here is the link again that you can access. You can also find the link in the chat. You can access to. Please give us feedback on today's event. We really value your input. For more information regarding our session or future sessions, please email us at info@danomaconsulting.com. You can also visit the Puerto Rican Cultural Center at prcc-chdo.org. To contact myself or any of today's speakers, you have our emails listed there, so we hope to hear from you. And as we close, before we go, we ask that you really take a moment, pause, reflect on how you can take charge of your health by using the resources that were shared today. These are resources from reputable scientific sources that are really valuable. Sources like the National Library of Medicine, National Institutes of Health, and so many other valuable resources that both of our guests today have shared. You can take advantage also of the local library, as we've heard, and talk to your librarian. I mean, we had two very approachable librarians here, very knowledgeable. They're trained and knowledgeable, and they can help guide you to the right information. So take advantage of those resources in your local library. But when in doubt, the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago is a trusted community resource with trained experts who care and have been supporting our community for nearly 50 years. They also offer weekly programs and events, as you've just heard a few of those. You can continue to follow those through social media as well as on their website to make sure that you continue to support yourself and prioritize yourself, whether it's your social, physical, mental well-being, that you take due care. Thank you again. Muchísimas gracias to Juan, Darlene, Jacqueline, and our invited guest. Thank you to our sponsors and today's host, the network of the National Library of Medicine. We hope that everyone considers enrolling in the All of Us Project. And we thank you again for joining us. Be kind and loving to one another. Plain and simple, gente, lean on love, compassion, and empathy. Together, we can rise above, make a difference. Peace and love. And happy Transgender Disability Day. Thank you, everyone. Have a great day. See you next week.